Hello, my name is Dr. Dewan S. Raja. Today I will discuss about heart sounds. Heart sounds are generated by the systole and diastole of the heart and the flow of blood through its valves. There are four primary heart sounds: first heart sound, second heart sound, third heart sound, and fourth heart sound, though the first two are most commonly heard. To listen for heart sounds, position the stethoscope bell downstream from the flow of the blood through the valves. First heart sound S1, it is caused by closure of the mitral and tricuspid valves. At the beginning of the ventricular systole, the heart contraction phase, sound often described as love. Location, it is loudest at the apex of the heart. Sound, often described as a love, and location is loudest at the apex of the heart, caused by closure of the mitral and tricuspid valve. Closure of the mitral and tricuspid valve causes fast heart sound. So we are looking at the image. This is from Grey's Anatomy for students. So heart sound. So there will be closure of the mitral valve, tricuspid valve. There will be fast heart sound, that is loud. In ventricular pressure is here. This is the ventricular pressure, is the lowest here, ventricular pressure. Okay. And in EKG, you'll get PQ. This is the R here. And this is the T at the end. And we have seen the second heart sound is caused by closure of the aortic and pulmonary valve. So second heart sound caused by closure of the aortic and pulmonary valve. Okay, so these two valves are semilunar valve. Their closure causes the second heart sound. These are the atrioventricular valves. This closes and causes the fast heart sound. Second heart sound causes closure of aortic and pulmonary valves, the beginning of the ventricular diastole, the heart's relaxation phase. Sound described as dup. Location loudest at the base of the heart, left upper sternal border. These two sounds together loved up from the basic heart rhythm and indicate healthy functioning of the heart valve. So first heart sound, second heart sound, we get the loved up, that indicates our heart is okay. Physiological splitting of second heart sound is normal, expected in most healthy individuals. Third heart sound caused by when it calls occurs during early diastole, during rapid filling phase of the ventricle, typically just after S2. Okay, during early diastole. Sound low pitch ventricular gallop, described as a lab dapta. Best heart at the apex with patient in left lateral decupitous position. Significance: this may be normal in children, young adults, athletes, and pregnancy, but can indicate mitral regurgitation, atrial regurgitation, heart failure, thyrotoxicosis, and dilated ventricle, dilated cardiomyopathy like that, heart failure, or volume overload in older adults. So these are the possible causes of third heart sound. Okay, so here we are seeing the auscultatory positions are little different from the exact valve position. So here we are looking at the anterior view of chest wall of a man showing skeletal structure, heart location of heart valves and auscultation points. Suppose mitral valve closure causes fast heart sound. We put the stethoscope here, we get the best sound here along the downstream. Like the tricuspid valve is located here, best sound will heard here. The pulmonary valve is located here, but best auscultatory position is here because blood is flowing there. We are putting our stethoscope bell to the downstream area like this aortic valve contract, and this side is the best side for auscultation. Fourth heart sound occurs in late diastole just before S1. Sounds a low frequency atrial gallop described as ta la da. Best heard at apex with patient in left lateral decubitus position. So both for the fourth heart sound, third heart sound, best heard at the apex with the patient in left lateral decubitus position. Significance of S4 fourth heart sound often indicates condition like hypertensive heart disease, stiff ventricle, ventricular hypertrophy, or aortic stenosis, common in older people and considered abnormal. There's some abnormal heart sound. We'll go in details about the murmur in our next videos. So just get a few idea. Murmur, these are swishing or whooshing sounds caused by turbulent blood flow, often due to valve abnormalities. There is stenosis or regurgitation. So the passage is abnormal here. That's why we are getting the heart sound. Sometimes too much flow, like in anemia, we may get also some specific type of heart sound. These are murmur. Murmur means abnormal heart sound. Abnormal heart sound due to abnormal flow and abnormal passage, like stenosis or regurgitation of the valves. Clicks and snaps. These can occur with conditions like mitral valve prolapse or stenosis. Friction rub, a scratching sound heard in pericarditis. Inflammation of the lining around the heart, we may get friction rub. Rub between the parietal layer of the visceral pericardium, the serous layer, and the serous visceral layer of the pericardium. So they go one above other. There is friction that will lead to friction rub. It indicates there is some type of pericarditis.